know that not all abdominal pain and fever is from malaria? It can actually be from appendicitis, and this, if not identified early, can lead to death. My name is Dr. Sylvester Agbadah. I'm a consultant general surgeon at Federal Medical Centre Ovwian. I'll be here to discuss the topic acute appendicitis. Acute appendicitis is when the appendix is inflamed. That is when it gets swollen. And it is the commonest cause of surgical emergency that affects the abdomen. Early intervention is important in saving most of the mortality that occurs in this case. It commonly affects young adults, especially between the age of 15 to 25 years of age, and is slightly more common in men. They usually present with abdominal pain. The pain usually starts at the periumbilical region, that is the belly button region, and later localizes at the right lower part of the abdomen. The other thing they can also come with, we also include anorexia, that is loss of appetite. They can also come with nausea, that feel like vomiting, and they can also actually vomit. They can also come with low-grade fever. So these are the commonest symptoms of the patient that has acute appendicitis present with. Once a diagnosis is made, early surgical intervention, that especially need to have surgery as soon as possible. Some of them may have vague pain that will come and go over years. Some will come within a day or two with perforation. That's one of the complications of appendicitis. That means it can burst. And when that happens, it can spread and involve all the abdomen, and that can lead to death of the patient. So coming to the hospital in time when you have abdominal pain, belly pain, is important in a patient that has this kind of condition. Delay can be so catastrophic. Most of the patients go to some other places for treatment, like going to chemists, going to herbal homes to seek alternate treatment. This is not really good. When you notice that you're having abdominal pain, it is very important for you to come to the hospital. Let the doctor examine you, request for some investigation, which will include laboratory and radiological investigation, including ultrasound scan of the abdomen. This will be able to identify what is causing pain in the belly, and of course making you to have early and quick intervention. Because if you delay, some of these complications that you will have will be difficult to treat, and you will not have a long hospital stay, and then you may even lose your life in the process. So it is important for you to go to the hospital, seek your health provider answer, so that they can quickly look at your case and treat you early enough for you to prevent those complications which are earlier mentioned, which include perforation. It can even form pus in your belly, and of course this is not easy to treat at all. In summary, acute appendicitis is the commonest surgical emergency that involves the abdomen. Early surgical intervention is key in preventing catastrophe that will occur to the patient.